This program is brought to you by Community Trust Bank, Medical City, Bid Select, and the Neely School of Business at TCU. Welcome to Platforms, the life-lifting news program for women. Now, here's your host, Siobhan Palmer.
Hey, welcome back everybody to Platforms, the life-lifting news program for women. This week we're talking about a very hot topic in healthcare called minimally invasive surgery. Our next guest is Dr. Chris Bell. Dr. Bell is a Dallas native and he graduated from Austin College with a degree in biology. He attended medical school at Texas Tech University Health Sciences Center, and he did his internship and residency in general surgery at the University of Texas Southwestern Medical Center here in Dallas. Dr. Bell, welcome.
Thank you very much. It's good to be here.
I'm delighted to have you, and we're here at Medical City Dallas, and this really is a big buzzword the last few years, minimally invasive surgery. So would you define in your mind what that is to our audience?
Yes, minimally invasive surgery is a new technology that has come out that really has a lot of benefits for patients. For instance, there is a quicker recovery, there is less pain, and a better cosmetic result from having fewer or smaller incisions.
Mm-hmm. And when did this new technology come out? It's relatively new, isn't it?
It is. It is. In my field of general surgery, it really became commonplace in the 1990s when surgeons began doing operations such as gallbladder removal laparoscopically. And since that time, we've had a real paradigm shift in general surgery, and a lot of operations are being done through a minimally invasive technique at this time.
You know, I remember my stepdaughter had her gallbladder removed laparoscopically, and I was amazed the recovery time. She was out like within 2 days, and years ago wasn't that literally you had to cut people open to remove the gallbladder?
Yeah, the traditional standard open gallbladder removal surgery might require a patient to stay in the hospital for up to a week.
Wow.
And so today we do the same operation as an outpatient, so it's really a good thing for our patients.
And could you take us through again, I know with previous interviews here, when you go through the belly button laparoscopically, you have to blow up the abdomen with gas?
That's right.
And
that's
that
right.
Opens up your visual point, I guess, for...
Yeah, that's right. The carbon dioxide, which is the gas that we use for laparoscopy, allows the space to be developed within the abdomen, which gives us room to work. And after the operation is done, the gas is removed. And so it's really a nice way to do an operation with very small incisions.
Right. Define what a general surgeon does. I mean, to me, it's like an internist. You're capable in many, many different areas, so each patient cases could be totally different here.
Yeah, general surgery encompasses a lot of different topics. In today's times, a general surgeon does a lot of abdominal surgery. That would be the majority of the specialty. But we also do neck surgery, such as thyroid and parathyroid surgery, trauma, and also breast surgery in terms of malignancies. But a lot of our work does involve the abdomen.
Right. Let's talk about new technologies, because again, it seems like almost every week you read about advancements in healthcare. So what's down the pipeline specific to minimally invasive surgery that you're seeing?
We've got some very exciting times ahead of us in general surgery. There are new techniques that are being developed and some that are already being performed at our hospital. The first one I'd like to mention is called single incision laparoscopic surgery, where we are doing operations through a single incision laparoscopically rather than 3 or 4 or 5 incisions, which has been really exciting. Another exciting technology is a technology called NOTES, which is a natural orifice type of an operation. And in those cases, there are no incisions, and so that is really exciting. I think this technology, NOTES, is in development, and we are a little ways off from using that yet.
Would you explain what that specifically is, where you would go into a natural orifice in the body, but once again, I guess it depends on the type of surgery, which one you would select to go in to actually access?
Right, right. So for instance, if a surgeon is wanting to remove an appendix or maybe a gallbladder, they may select to go in through the stomach by way of the mouth with a flexible scope and to remove that organ through the stomach.
Okay, tell me again, so you would go through the belly button to access?
Actually, in the NOTES technology, the surgeon would go in completely through the mouth.
Through the mouth.
And into the esophagus and into the stomach. And by way of the stomach, remove the organ that is inflamed or is causing the patient problems. And so this technology is really exciting. It's on the horizon. We still have a lot of development to do, but this is a hot topic in our specialty for sure.
And in terms of the actual equipment itself, when you enter the body, how do you ensure that you don't inflame or irritate the entry point in the body, you know, as you're going into the...
That's a great question. A lot of the instruments are deployed after the instrument is in place. And so going through the mouth into the esophagus, the instruments would not be active or deployed through the endoscope at that point. And so, we wouldn't have that kind of issue or concern about injury.
What about candidates? Tell us the criteria that you would look at. Is there age-related decisions you have to make with a quite elderly patient doing this type of surgery vice, you know, a younger patient you might have?
The age is not as important to me as a surgeon. I've been doing single incision laparoscopic surgery here at Medical City for over a year now, and my first patient was in her 70s.
Really?
And so the age issue is not as important. There are other factors that I look at to determine if someone would be a good candidate for a single incision operation, for instance, a gallbladder removal. If a patient's had multiple surgeries before, they may not be a good candidate for this technology because the amount of scar tissue may be higher in that patient. And so that is certainly one thing. And then I think it's always important to know what degree of inflammation we're dealing with. If someone has a severely inflamed gallbladder or appendix, that might not be a good candidate for this technology.
Okay. Well, Dr. Bo, we're going to go to break in just a moment. When we come back, we'll talk about some of the newer technologies, and I'd love for you to share some case studies with some of your patients, some of the more challenges you have as a general surgeon.
Sure.
Ladies and gentlemen, this is Siobhan Palmer with Platforms, the life-lifting news program for women here at Medical City Dallas. We'll be back in a moment.